First of all, everything is not okay when it comes to people's mental health. And I think especially after 2 years of a global pandemic. I mean, we had mental health challenges prior to the pandemic. It's only gotten worse during the pandemic and is really a full-blown crisis. Some people are calling it the shadow pandemic. So the Ontario Greens have made the $1.5 billion funding commitment in our costed platform to bring up mental health funding to be 10% of healthcare funding. Because you're right, it is 10% of the disease burden. I was so impressed that you had that statistic. And as part of that, we would expand services to make mental health services available through OHIP. Because for so many people, they're struggling to access services, but when they are, they're not able to afford them. And so if mental health is health, and I believe mental health is health, then it should be covered under OHIP. Like other forms of health. I mean, if you went to a hospital and said, oh, I broke my arm, and the doctor said, oh, well, come back in a year and we'll fix it for you, only if you can afford it. Like, that would be completely unacceptable, right? So why are we forcing people with mental health challenges to be treated in that way? We've also made a firm commitment to reduce youth mental health wait times to less than 30 days. Right now, 28,000 young people are on a wait list that's an average of 18 months, sometimes as long as 2.5 years to access mental health services. And so we've made the funding commitment to make sure they receive those services through OHIP within 30 days. And then finally, we have to address the substance use crisis that's unfortunately killing so many people in our communities. So we are saying, let's expand harm reduction and consumption and treatment sites and treat the substance use crisis as a public health issue, not a criminal justice issue. And one of the most important ways we can do that is to provide housing for people. So many doctors saying, people who are facing mental health and addiction crisis, we should be writing them a prescription to get housing. Well, the Ontario Greens Housing Affordability Strategy answers that call with a firm commitment to funding 60,000 permanent supportive housing spaces with wraparound mental health, addictions, and other supports to stabilize people's lives, to get them on a path to their own personal well-being and health. And so, we can provide them with the dignity they deserve, and all of us benefit. One study shows that every $10 invested in permanent supportive housing saves government $21 in healthcare costs, first responder and emergency costs, criminal justice and policing costs. And I want to close with one final point that I think is really important. We're the only party calling for a standalone 3-digit helpline for when somebody's in a mental health crisis. Instead of having to call the police, because sometimes the intersection between race and policing, especially when it comes to mental health calls, leads to significant negative outcomes and sometimes even loss of life. And so having a mental health response instead of a police response is something that police are asking for and something that community activists are asking for, because it starts to redefine what community health and community safety is. And I'm proud to say that our plan was the first plan that any political party in Ontario's history has put forward as a standalone mental health strategy, because we know that mental health is health.